Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. Let's talk about daily routine. One of the things that, as a doctor, we always had to deal with when a person was in an accident was the question, have the activities of daily living been impaired or modified? What it means is, can she still do the laundry? Can she still vacuum? Can she still cook? Could she go shopping on her own and carry things in? All those little things. But in my mind, it goes even further than that, because people who have injuries modify what they do during the day. For example, I saw a lady a couple of days ago who had, well, first thing Monday morning, she had an accident at home where she just reached way too far and heard something move. And she came on all torqued, and bottom line is, when I finished checking her, I told her she needed to go get an x-ray because she may have broken a bone. And she did. She got an x-ray and she had a broken bone from compression fracture, just from exerting, twisting, reaching. Now, of course, the bones are probably already somewhat deteriorated. They were probably weak. But because of that event, for the next 2 months, her activities of daily living have been significantly modified. So the question would be, what is your routine in your life? Now, I like to know that when I have a new patient come in and I interview and to assess their health. And I start out with very simple questions like, do you have breakfast? And many times I'll get a long pause. I know what a long pause means.
No breakfast.
I try to think of something that I might want to hear. What about lunch? Same kind of thing. Well, maybe, sometimes it kind of depends. And dinner is a little more routine. When they have a nap, well, they can't think of something to say. So it's obvious to me right away, they don't have a routine. They're like a wild animal. If you go deer hunting, deer try not to do the same thing every day, because they know if they do, they get caught. But to be healthy, it's better to have a routine. Okay. Having said that, I recall a time when, many years ago, Audrey and I were called to work in the Denver Temple, and it became very apparent to me right from the onset that within I call it the kingdom of God as routine. And everything has order. So in the temple there was a place for everything. There was a file for all of the protocols, all of the things we did. There was a place for the tables to be located and the lamps on the tables. And if the cleaning crew happened to slide the table over a little bit and got caught, they got in trouble because it belongs right there. That's the routine. And so, having said all that, I had a class one night where I had one person in the class. And it was meant to be. I mean, she needed the whole class. She was a young, healthy, relatively school teacher who was very dedicated to her students. I'm sure she was an exceptionally good teacher. But from an overall health perspective, she was not quite up to the plateau that I thought she could be. She was kind of stuck down here. So I get an idea in that class, and they drew a 24-hour clock on the, I had a big whiteboard, and they said, okay, I would like to know, let's talk about your routine for 24 hours. She got up at 5 o'clock, exercised, cleaned up, had a good breakfast. Her day went, she would get an A, not a B, all the way around. We clear down to evening time. 9 o'clock, 10 o'clock, she's preparing her lessons. 11 o'clock, 12 o'clock. So her routine was not to go to bed until she got her next day's lesson totally in order. And sometimes it would be 1 o'clock in the morning. And she's up at 5. Well, that solved her problem because we identified exactly her routine and it was way off kilter. So for a while I made forms and passed them out to people to find out what their routines were, and then to make minor changes in them to, we call it, do what healthy people do. What kind of a routine do you have that parallels what healthy people do? And it helped a lot of people. So back to the kingdom of God, the world and the universe. I can go on my phone and I find out exactly what time the sun's coming up. Tomorrow and the next day and the next day. It changes every day, it changes 2 minutes. The days go 2 minutes longer, 2 minutes shorter. But that's the order in the universe. So my recommendation to each of you is to consider your own routine and get one. And if it needs to be modified, then modify it. Just like I've done. I've been on the schedule with classes 4 days a week. It's not quite working for my health, so I need to make just a slight adjustment. That's why I'm going from 4 classes to 2 classes, so that I can get more downtime to renew and regenerate and recover. So, any questions on what I just said to you? So, I guess the bottom line is, don't be like a wild animal. and where the routine for them is wander. Don't do the same thing all the time. That's what, don't do that. Do a routine. So your body knows when it's time to eat. And when it's time to eat, eat. Eat by the clock. Pick a time, morning, noon, and night, Or if you do 3 meals, you do 2, pick 2 times. If you do 4, pick 4 times. And eat by the clock. Go to bed by the clock. Even if you're not tired, get in the routine of going to bed at a certain time. And determine how long it takes you to get ready to go to bed. That's another question I ask people, when do you go to bed? And sometimes they say, how long does it take you to get ready to go to bed? Sometimes it's 5 minutes. Sometimes it's longer. To me, it's longer. Because to me, I know, and I've taught you, at nighttime is when the body heals better than any other time. That's one of the reasons we're having this class today. Is what part of your preparation for healing during the night is to go through the self-care protocols properly to line up your body so that during the night you heal at the best possible capacity. So for me, between the time I start getting ready for bed and go to sleep, it's always about an hour and 15 minutes. And I do my self-care, I do the T-zone, I have a soak in the bathtub, do my routine to get ready to go to bed so that I go to sleep and heal during the night. My body knows that I'm going to have a nap about 1 o'clock in the afternoon. And even if I'm not tired, I get in bed, have a nap, and I do. And people who start to do what I told you to do, who tell me things like, well, I never nap. I don't have time to nap. I don't need a nap. Or when I have a nap, I don't sleep good at night. Well, that's because you didn't train yourself. I always sleep. I can always go to sleep at night before 10:30. Even if I've had a nap, and I always do. My body is ready to nap. So train your body to do certain things and do it by the clock. Any comments or questions? You're a pretty quiet group.
I would say on the other end, the wild animal that has no schedule, no form to their day, to not be so rigid in your schedule that there's not room for a little bit of tweaking, a little bit of something took too long or whatever, because they're both extremes, right? So schedules are great because they help us know what's coming.
And there are always exceptions.
There are always exceptions,
So
but your schedule shouldn't be exceptions.
So I say to have a plan, but like another directives that I've given to you, just get it big. Do it most of the time.
Yeah.
Okay, we're going to go through this active self-care. This is different than you've had before. It's called philosophy, anatomy, and physiology. So I separated this test into 3 separate parts. Philosophy section, number 1. The power that made the body is the power that heals the body. True or false? True. Now, a question that might be associated with that: do lotions, potions, pills, surgery heal the body? No, they don't. They don't. They're not intended to. They're intended to treat symptoms. But true healing comes only automatically from the body. Number 2, innate, or the life force travels from above down, inside out. True, that's in your body. Now again, let's talk about that further. Because that applies to the body. That's what we're talking about. But let's go outside in nature. You've probably all seen in the mountains big trees growing out of a rock. And you go, I wonder where it gets its nutrition from. The rock? So a little tiny seed fell down there and grew. So where did the energy come from? I'll tell you. Mother Earth. Now I can prove that because I have hanging plants in my backyard that have to struggle to keep looking nice. They're in the same pot, the same soil, they get the same water, the same sunshine, but they're not connected to the earth. We've had a few of them that, frankly, they didn't look like they were going to make it. So Audrey took them out of the pot, put them in the ground. Guess what? They flourish. Why? They get energy from Mother Earth up. That's another proof that the concept of earthing, like those earthing pads you put in your bed, you get energy from them. Only in the body does it go from above down inside out. Unless you go earth and ground, then you get it from both ways. And if we ask the question, what's one thing the healthiest people do? They spend time with their feet on the earth. It doesn't count in the house because we're insulated. It doesn't count on the concrete or the pavement. It counts in the grass and in the dirt. So when you get a chance this summer, get in the dirt and get that earth in from the energy from Mother Earth. Number 3, the greater my faith in or trust of my innate healing power, the greater its ability. Totally true. Like number 4, lack of faith or trust in my body's ability to heal lessens my recovery. Now we go to anatomy. Each bone, articulation, or joint, and the body is specifically designed to align and function efficiently with each of the other bones it is in contact with. True. Now, you have 206 bones in your body. We can take every single bone in the body, and look at that bone, and if you really knew your anatomy, you could say, oh, that bone goes in the foot right there, because that's the only place it will fit. It's like a puzzle. So all joints are shaped so that they fit smoothly with the joint next to them. Number 6, the more symmetrical joint relationships are, the longer they last and the better they function. True. One of the most complex joints in the body is the sacroiliac joint. In fact, I'm gonna go get one. The sacroiliac joint is huge. You have 2 of them, one on each side in the pelvis. They're very irregular in shape, but they fit, and they belong in a certain spot, and they fit snug enough that they know where they belong. They fit loose enough that if you crush your legs or you fall and land on your butt, or if you sleep with your leg over, you can misalign the sacroiliac joint. That's one joint that I nearly always have to help when I align bodies. And that's why when we talk about the sacral slide, That's one of the most important things you can possibly do, to lay on your back and slide one hip up and down in a relaxed state to get those joints evenly aligned, the even amount of tension on both sides, and to keep them moving. They must move. All joints move some. Some joints, like the shoulder, moves a lot. Some joints, like the hip, moves a lot. Some joints, like the ankle, is only designed to move in one direction, so that that bone right there is a level surface that all the way to the tibia, half of your whole body's upper weight, and all of it when you're walking, going one foot to the other, all of that weight hinges on that one joint. It's very hard, it's very strong, but that's the design. And if you have a misalignment in the foot, it then misaligns the ankle, and they have problems. And the problems extend above the ankle into the knee, which we'll talk about in a few minutes. Number 8, when within acceptable alignment and motion, joints are designed to outlast other systems, like your heart, your kidneys, your lungs. True. Number 9, repetitive micro-trauma. Absent of repetitive microtherapy hastens degeneration and breakdown. Rapid easier. I had a lady within the last week who came in, and I was assessing her neck. And I told her, "You've had an injury to your neck. Do you recall what it was?" She said, "I've never had an injury to my neck. No car accident, no fall, no bucking off horse of, sports injury, no." I said, "Well, you have, usually this kind of, I could feel scar tissue, and I could feel lack of motion. And I knew when I touched it, she felt pain." I said, you've had trauma. If it was not a single trauma, it was probably repetitive micro trauma. And I said, like sometimes I see dental hygienists and even dentists who work twisted with their head down. They spend a lot of time. They put the tools there, so they're always doing this. That's repetitive micro trauma. And they don't do counter therapy to undo the stress. And she said, "Oh yeah, I was a dental assistant for 18 years. Which way did you look?" "Right over there." That's exactly what she had. Now the good news for her was, even though she was in her late 60s, that degenerative change in her neck from repetitive micro trauma that's been there for many years can be resolved by repetitive microtherapy. So how many times? 5, 10, 15, 20, no, probably hundreds. So she's gonna have to be on her T's on and turn her head and lean to undo that stress a little bit at a time, to give the body time for the new tissue to replace the current scar tissue that's been built up in the neck. Neck and up into all of us, and up into all of our joints. That's the good news. Number 10, supportive nutritional products enhance both strength and endurance of all tissues and systems. That's definitely true. In class yesterday, somebody said, "So what's an example?" An example is, the best example is the magnet stem. The magnet stem helps the body to make more new healthy stem cells, and they go off and become whatever's needed. Number 11, the best pharmacy and the best doctors are gifts from the Creator and are contained within my body. I think that's a true statement. You'll never find a smarter chemist than your own body. And now we're going to review active do-at-home self-care protocols and techniques. I think all of you probably have a copy of those. We're going to review them briefly from top to bottom. So you may be doing them now at the level of B. If you are, fantastic. That's all I expect. Don't try to get a straight A. It's not worth the stress. But don't get a D. If you're not doing them, and it's common that people feel better and then they stop doing what worked to get them to feel better. I recommend you do these techniques all the rest of your life. Now the question is, how long does it take to do them all? Well, it's going to take me 31 minutes to explain them in detail. But last time we did this class, we had Deborah here, and we timed all of them from start to finish. You can do all of these techniques on your own, at home, in under 3.5 minutes. And I recommend you do them at least at the level of a B. What that means is try not to skip 2 nights. If you get misaligned, you want to line things back up soon. It's kind of like your home, you know. My wife likes to go to bed with the house in order. Whenever we go on a vacation, everything is clean before we leave. When we come back, everything is clean. And the body is much the same. When you go to bed, put everything as close to normal as you can get it, so that during the night, your body can repair. Now, we've talked occasionally about what does the body do at night? Is night time off? Does it shut down, wait till morning? No, it's exactly the opposite. When you go to bed, your body goes to work to heal and repair and regenerate and renew. And so that's the time you want everything aligned as good as it can get. Now, I've said the word aligned and often. What does that really mean? If your body is out of alignment, I'll use the neck for an example. Every joint in the neck and the whole spine, even down to the pelvis, belongs in a certain position. If it's not where it belongs, then you get a modification of the quality of nerve flow. You have nerves that leave the brain, go down the spine, out through the holes, the foramen in the spine, and they go to muscles, organs, glands, and they provide directives from the brain down. You also have nerve tissue that goes from the organ, like your gut, your lungs, your brain, your eyes. Sensory nerves that go in up to the brain to function. We want those all open and clear so that during the night you can heal and repair. Now, the question often comes up, well, Doc, I can't sleep because I have pain. If you have pain bad enough that you cannot sleep, and I recommend some kind of a natural pain reliever. There are a lot of them. I do not recommend you take a pain pill because your back hurts and you have garden work to do. So you take a pain pill and go out and work in the garden. But if you do that, your body will not be aware of the problem and will not be able to guard efficiently, and you will actually do more damage. So don't ever do that. If you have enough pain that you should be in bed, then get in bed. If you can't go to sleep, take something to allow you to sleep. Okay, we're going to start with a sacral slide. And we're going to work out. Now, I'll say again, the sacral slide is the most important to begin with. Not period, not the most important, but the most important to begin with. Why? Because we want the foundation of the nervous system neutral. So you lay on your back. I recommend, when possible, you lay on a carpet on the floor so that the hips and the ribs line up with each other. If you're twisted and you lay in bed, you maintain the twist in bed. You don't get as good a value out of it. Now, if you can't get up and down off the floor, do it in bed. In bed is better than not doing it. So you lay on the floor on your back for a minute or two. Scoot your scapula, shoulder girdle together. Put your palms up, aim the thumbs up, scapula together, and push gently, and then relax. If you have rounded shoulders, you have a shoulder problem, elbow, carpal tunnel, then maybe do high, medium, and low, but turn the muscles on in the back, off in the front. The body will, they're called antagonists. If you turn the back ones on, the front ones turn off. During the day, if you've been working up here, you've had the front ones turned on, the back ones get turned off, they get weak, and the shoulders slide around like that. That changes the alignment in the shoulder, the elbow, the wrist. So you get all kinds of problems down here. They can't be fixed until we get the scapula and shoulders back. So you might as well, you're on the floor, you might as well do that. Now, having said that, remember this. When you push on the floor, you're not primarily retraining muscles. It's primarily changing the nerve flow. We want the nerves run muscles. Nerves are like teenagers. They learn bad habits by doing the same thing over and over again. So they learn to be misaligned. You have to retrain them to be properly positioned. So it's a medical it's called neuromuscular re-education. They know what to do, they just need to be re-educated to do it. So hold the shoulders back. Now, when you're ready to do the sacral slide, as instructed in the handout, you point both feet straight out. The knees are straight. We're not going to bend the knees. The sacral slide is not about the feet. It's about the sacrum. We're going to take a deep breath, and as we take a deep breath, we're going to slide the right leg away from us, and we're going to pull the left leg up. Pause. Then when you're ready to blow out, create directions. You think the words, I'm getting better and better on the inhale every day and every way when you exhale. That's step one. Step two, you turn your feet out. Now, why do you do that? When you turn your feet out, it has a different effect on the low back and ribs than when your feet are straight. And you do it again. Then you do toes in. Now, I had a young lady ask me today, I have a lot of tightness up between my shoulders. What do I need to do? When you do the circle slide, and you turn your toes in, you get more value higher up. When you turn the toes out, you're getting more value down here. And if you apply a neck roll, and I recommend a roll of towel so you can change the size and density, low under the neck so the head touches the floor. If you do the neck roll and the circle slide, now you're doing neck therapy. You're doing rib therapy. So you will correct minor misalignments in the rib cage. You will correct minor misalignments in the spinal column. Now, having said that, if you have a digestive issue or a lung issue or kidney or liver, you probably have misalignment affecting the nerves. The nerves can be affected by pinch, by twist, by stretch, or all three. You can be on one side only, or both sides. You can have a kidney problem on one side and the other kidney is fine, because the nerves on this side are misaligned. And if you do the sacral slide properly, you line them up as good as they can get at that point in time.
Just a quick, so when you go, you come back or you come back to even?
You pass.
Okay.
So go.
Okay. Okay.
Then you go back to even and change positions.
So you do all you do it, if you go straight out, you do with one leg and then come back and then do it with the other leg?
No, so they're both legs at the same time.
Okay.
Watch my hands. These are my feet. So in essence, what we're doing in the pelvis, we're going like this. See how about, and this hooks onto the spine. So that's why you can give yourself a low back adjustment by doing this.
So, does that make sense?
Pardon?
I don't know your name, sir. Does that make sense?
Did that make sense?
Well, I still don't quite understand if I do the first one like this.
Okay, Denise is going to show you exactly how to do it.
She showed me once, but somehow I forgot.
That's okay.
I'd love to see this.
So watch I'm gonna put my hands on my hips, okay? So I'm breathing in. Come back to neutral. Turn my feet out. Come back to neutral and turn my feet in.
That's how you do it. Then you do it again.
And then at this point, she's done.
No,
No, she's
I'm only
half done.
halfway done.
But she's going to do the same thing again with the feet, but she's going to start with the other leg.
Okay.
Okay.
Oh, so you just do it. Okay.
Now, why start with the other leg? Because most most of us are not symmetrical. One side has more stress. We want to even them. Now, let me make a comment about how far you slide. How hard do you reach? How far do you push? The answer is about 80%. Don't try to break the bank by going way down.
Thank you, that was nice.
Thank you.
Okay.
Good.
Now, we've also talked about a team of horses with the big horse and the little horse. When you do, the body should be symmetrical. If we had a old-fashioned team of horses pulling a plow, we had a little horse, we had a big horse. Obviously, the big horse can do way more. So we have to make sure the big horse is smart enough to match the little horse. So when you're doing this in motion, try to make them about the same. So, for example, I had a lady who, last week, she went about 3.5 inches with her right leg, and the left leg only about 1. That was unevenly matched. So I told her to slide on the floor over so her feet were about 2 inches from the couch, and then slide both feet to the couch. So they ended up being the same. Same with turning the feet out. As you know, some people, when they walk, they wobble and they'll lean to the right, they lean to the right. So when they lay down, the right leg goes out. And when they do the sacral slide, they may be able to go clear out here and only here. Same principle I just mentioned. We bring them up so they match. We always match the most restricted. Same when you're on the T-zone. If you turn your head right and left, and one side goes way over and the other side's limited, do the limited on both sides. Okay, going on. I'm going to do the thoracic roll very quickly because a lot of people don't have to do this, but you can do it. You're still on the floor, your arms are still out. Now you slide your feet up, your knees are in the air, your feet are flat on the floor. You got it? You're laying flat in the back. You slide your knees up. That makes sense?
But your feet are on the
Your
floor.
feet are flat on the floor.
So
You just brought your feet like this, so your knees are up. Take a deep breath, and then slowly let your knees, which are up, go to the side. That rolls the rib cage. And you let all your air out. Then you breathe in. As you breathe in, you bring your knees up, cross over, out. And we're going to do this. That was 1/3 of the exercise. The first time you do it, you breathe deep. That means chest high. Second time you do it, try to breathe wide. Third time you do it, you belly breathe. So you're rolling your hips, which rolls the ribs, which realigns ribs.
and you leave your shoulders
So
on the floor.
You're still out here.
So you do 1, 2, 3,
Exactly.
and each time you breathe chest and then
Wide.
Deep, wide, and belly. And you're done.
Pretend your rib cage is a balloon and you're trying to make it squish one way and then you're trying to make it squish the other way. Does that make sense?
So they're all slow. You don't throw your legs down. You don't drop them, just lower them and let all the air out. Yeah. Okay. Occipital release. Now this, again, is one of the most important things you can ever do to help your whole body. The blue bone is the occiput. It's a bone in the bottom of your head. When we do the occipital release, we are not on the neck. We put our thumbs on the bottom of the head, close together, and we push on the head in that direction. We're pushing in that direction. At the same time, we're going to raise the chin and pivot the head this way. So what we've done, essentially, we're holding the occiput and praying and breathing. We take a breath in and we're pulling the joints apart inside the head. The orange bone is the sphenoid bone. That's the most important bone in the head because of all of the nerves, and it moves. Every time you breathe, it moves, unless it's stuck. Now, most people who have had any kind of a trauma, that bone will not be moving properly. Like my lady friend who was a dental assistant, her head was not symmetrical. The head should be even on both sides. And when you breathe, the head moves in this fashion. The sutures, if your head is healthy, the sutures move slightly. If they're not, they will be sore, and your brain cannot function like it could because it affects the blood and lymph flow and nerve flow underneath that suture inside the head. So you put your thumbs there, you find a tight or tender spot, breathe in deep, raise the chin.
Just a little bit.
Pardon?
You raise your chin just a little. You're not looking all the way up, just a little.
Yeah, you raise your chin about an inch and a half.
Oh, really? That's all.
Only slight amount. As you breathe in, then as you breathe out, you let it back down. Then you slide the thumbs out wider. Would you get her some water?
Yes.
And you can slide the thumbs, go wider and wider until you can go clear out to the edge.
So you can do it several times?
Several means 4 to 6, not 8 or 10.
Okay.
4 to 6 times. Now, usually, if you have any kind of an issue, there will be some tenderness when you put pressure. There will be some tightness on the tissue underneath the finger when you put pressure. The goal is to do it often. Eventually, you'll have no tightness, no tenderness, and you'll even start to hear when you do that. You'll hear kind of a light crackling, and you'll know you get in motion. Now, that pressure can come in one day, but if it comes in one day, it will feel thin when you find the tender spot. It'll feel like one sheet of paper. If it hasn't been worked for a long time, may feel like you've got 10 sheets of paper. They'll be really thick back there. I have a young fellow I've seen him for a couple of years now. A very good athlete, but he doesn't do his homework like he should. So I can tell when I assess his head, I know he hasn't been doing his nightly therapy because one side gets built up, very tight, very restricted, and that affects his whole body. His gut, his legs, his feet, his shoulders. Occiput release. Now, question comes up, can I teach my grandchild or my friend how to do this? And the answer is yes. Any person can do this therapy with no fear of harm. If you do them the way they're instructed on here, you'll always benefit. What's the best 2 times a day to do them? Morning and night.
So you're supposed to do it twice a day?
You can do it 4 times a day.
Oh, okay.
If you only do it 1 time a day, what's the best time?
Nighttime.
Nighttime.
Before bed.
Yes, and then next best is in the morning before you get out of bed.
Okay.
And any time. And you do them in this order. Circle slide, occipital release. Now we'll go to the next one. Microcranial mobilization. The microcranial mobilization is where you apply, first of all, you find the location. Right about 1.5 inches past the eyebrow to the low spot. It's very pronounced. There's a definite low spot. That is the intersection of 4 different bones. If you apply broad general pressure and it's tender, that means something's stuck. Something is not moving like it should. So now we're going to find out which direction needs to be moved. So you find that spot, you can use your thumbs, you can use this point, you can use your finger, it doesn't matter. I like to use my thumbs. And you push first toward the eye and breathe. If it's tender, it's not moving like it could and should. Then you push, breathe again and push back. Number 3, you push straight up. And number 4, you push straight down. Now, that's not a trigger point. We're not doing massage. We're doing bone mobilization. The intent is to create slight motion in the cranium and align the cranial sutures. Now, the cranium is like a swing in a park. If we were to go over to the park and build a swing, we'd construct it. We would want the top pole to be totally horizontal. We want both of the A-frame legs on both ends to be lined up. Then work up the swing. If we're crooked, the swing won't swing straight. Now, I don't know when you were a child if you ever got on a swing that was crooked. Sometimes they would hang 2 ropes in a tree on the branch, and they weren't straight, so you wouldn't swing straight. I told you that because if the head is crooked, the jaw swings crooked. So the true cause of most TMJ problems, misaligned jaw, is cranial misalignment. That's how you do that.
When I first tried that, started doing that, my jaw was felt like it was way out of line. And I realized I went around that it was out of line before, now it was straightening up.
How is it now?
It's good.
Yeah. Good.
So I have a question.
Yes.
When you say 1.5 inches, am I not going far enough?
Are you in the hole?
I think so.
Yeah.
Yeah, it's right there.
Yeah. You're about right. It's
You feel
about
that real soft spot right there.
it's about an inch or so
Yeah,
behind.
yeah.
You're too far back. You're right there.
Right in there.
Okay. We'll put it back. Nasal spread. This is for people who have congestion chronically. Again, God designed the head so you could put your thumb right there on both sides. You're going to pull out and up. So you take your thumbs, top of the nose, under the eyes, rub all the back of your head, pull up and out and breathe. And blow. Up and out, blow. 3 times. About 6 months ago, I had a fellow who, the first time I saw him, one of his main complaints was, I can't breathe out of my nose. I haven't been able to breathe out of my nose for 6 years. That's a big problem. A lot of discomfort. I went through these steps with him, showed him how to do what I've shown you. About an hour and a half after he left, I got a phone call. He said, I can breathe out of my nose, first time in 6 years. So he corrected a significant cranial misalignment that had been having a negative effect. That's the nasal spread. Now the scapula squeeze. I've already talked to you about doing that on the floor when you do sacral slide. You can also do that in a doorway. If you go to the door stop, about this far before you go through the door, you lean on the door frame, put your hands high, medium, and low, and let your body just lean through to squeeze the scapula back together. So if we measure between here and the other one, these go back together. And you do high, medium, and low because you have 3 sets of muscles. They're called rhomboid muscles. They go from the scapula over to the spine, high, medium, and low. So you do all 3 sets on both sides. Now, the foot. I call it dehobbling. When you stand for a long period of time, and the front part of the foot gets tired, it pronates. The tendons on the bottom of the foot get elongated. When they get elongated, they get weak. They create sometimes plantar fasciitis, creates heel spurs because they all attach right back here. That bone grows, becomes sharp point. Now it feels like a pin or a needle because the body's too far forward. When that happens, you get a negative effect right here in the bottom of the foot, where the back foot and the front foot touch, right where my finger is. So those bones stick together. So to dehobble, you put a golf ball on the floor. You could put it inside your sock. Put it right there, right there. That's where the back foot and the front foot join together. And then you roll your foot so the golf ball separates those toes apart. Now, why did it do that? It did that, it got stuck because you have spent too much time leaning forward and the foot went down. So guess what happens in the knee? The knee goes in. So now we have a person who's flat-footed, knees are crooked. When they walk down the hall, their leg wobbles. They get their candidates for a knee replacement because when they put their, they've changed the shape of the joints by improper use and not enough repetitive microtherapy. When the knees get bent too far in, what I do frequently, I'll measure, I'll put this on the lower leg and this on the upper leg. It should be pretty straight. The knee should be aligned, but I often find this, so the knee goes in because the foot went down. So what do? At bedtime, we put a book between the knees. Now they can't get their feet together because their feet go out. But we put a book between the knees and have them try to put the feet together. Maybe get a partner to hold them and then do this with the feet slowly 10 times. If you do that often, you can change the alignment of the knee from being here back to here. I've helped a lot of people do that. At any age doesn't matter other than speed. You recover faster, younger. Again, back to the first handout that I give you. All tissue has all joints have a position that they like to be in. I want to say one more thing about the knee. If you're straightening out your knee or your foot, and you're doing this with your feet, that changes the tension in the tendons and the nerves. Again, we're doing neuromuscular, and in this case, tendon rehabilitation.
And you're doing that laying?
You're laying flat on the floor and you have the book between your knees. Your feet are aimed straight up and you're doing flutter. Now, you're going this way and this way with your feet.
Oh, yeah.
I'm going to point out 80% of the value is at the end. So it's like fishing. There are no fish in here. The fish are on the banks eating the bugs. That's where you get the highest value is at the end. So don't do too fast and do the middle only. Go slow and do the ends. Go slow and do the ends. Okay?
Okay. Now, in your routine, you gotta get your T-zone. So T-zone comes after doing this, because you're starting the day with this. And then you do T-zone, or?
I do this in bed, and this T-zone I have to get out of bed after my morning bath. Thank you. I hope this helps you a lot. Welcome.
Hey, thank you.
Did you rip those up? Okay. Thank you. So you can share this with anyone.
Thank you.
And she's going to put this class on YouTube so you can go back and watch it.